Hi, everyone. This is Sharon, the creator of, or shall I say, the host of the Informed African podcast. Welcome, welcome, welcome. And so, for this episode, what I want to talk about is how to access mental health services. What can you do as an informed advocate? What can you do as a caregiver? So whether this is for yourself or this is for a family member or a friend, and if you are a professional self-caregiver, again, how you can access mental health services for someone else. And so pretty much most people, well, that's not true. Sometimes people don't know where to start when mental health services needed. When I would say in general, when someone wants therapy, you can go to, the internet. I would say ask family and friends and your coworkers, because again, the only way that we can stop the stigma is to talk about it more. If we, continue to not talk about it, then it doesn't get talked about, and then there's that shame that can go along with it for people who are experiencing something. And so ask someone. And when I say that, meaning that even if you are an informed advocate for someone else, because that's the other thing, sometimes, definitely if the person is experiencing themselves, they have a harder time, or they may not be able to because they're so overwhelmed. However, if they have a family or friend who is helping to support them, you are their voice. And so definitely reach out to family, friends, because there's someone, and if you're working as co-workers, again, if someone is looking for a therapist or some type of support. And so at that level, I'm not going to say that it's easy because I'm just giving you just the basics. Because the mental health system is it's a multi-level system, and with that is complex as well. And so you can start off by talking to family, friends, and asking coworkers. Or you can go to their internet and then, put in mental health therapist. And then a whole list of things will come up. So basically, you can go with an agency. I kind of call them you can go with the agency, private practice, someone who has a individual practice, or where there's a joint practice where there's 7 clinicians. Some clinics, I call them clinics, some centers may be associated with a hospital or with a university. And usually with most universities, you would be like a medical university sometimes when they're open for the public. And so you can do that. Sometimes the United Way can give you some resources of who you can call as well. That's one way. And there's different search engines out there. In this video, or something video, but in this podcast, I'm not going to go into all the details of specifics per se of the search engines, but we will talk about that at another time. But this is a general. I want you to know that there is support out there if someone is in need of mental health services. And so another level of mental health services, because it really depends on what the person needs. And let's say they need more services or something beyond individual therapy. And so, and there's that level of something before they don't need hospitalization, they don't need inpatient. And so there is a level in between that. Most people, well, some people. So it's called partial hospitalization or intensive outpatient. There may be some other things, and there's also, I forget what it's called, but it's a stabilization, but it's not considered hospital, crisis stabilization, but it's not considered hospitalization as well. But that one is closer, so I wouldn't put that in that middle piece. So in intensive outpatient and partial hospitalization, these are outpatient services, meaning that they are not inpatient. However, there are some inpatient facilities that may provide them inpatient. They call it like room and board, but they're not considered that. And so basically, like with your insurance, your insurance will pay for their services if it is inpatient per se. But again, they're not inpatient services in and of itself. And they may, but you would be responsible for the room and board. We need to stay there because they're not inpatient. That's the reason. And so with intensive outpatient, that would be the next level above therapy. And again, there's so many different services. But with intensive outpatient, there's one for mental health, there's one for substance use, and then some programs that they call dual, meaning that they definitely do address both. With intensive outpatient, it's usually 3, sometimes maybe 4 days a week, 3 or 4 hours a day. Each place is different of how they may provide those services, but it's always in group services. Most places do not have where the person can talk individually. You usually do that at the onset of the assessment. But it is, again, it's very intense. It's pretty much with both the intensive outpatient and partial hospitalization. They're both psychoeducational and psychoeducational and psychotherapeutic groups. The psychoeducational piece of it is where in the group, the individuals who lead the group, they are the ones who provide like different information regarding that maybe the person's triggers, different ways of coping, and things like that. And then when it's like the therapeutic piece of it, it gives members of the group to be able to express and talk about what's going on with them. And again, these are led by master levels individuals. And then with the partial hospitalization, for the most part, intensive outpatient and partial hospitalization are really, they're really the same. The basic things that makes them different is that partial hospitalization is 5 days a week and for 5 or 6 hours a day. Most of the time it's 6 hours a day. Some programs may have it 5. And then with partial hospitalization has to be pretty much there has to be a medical provider to oversee that program. With intensive outpatient, it depends. It depends, I have to say it depends, it really does. Sometimes it depends on the programming, and sometimes it depends on the insurance and accreditations and things like that. So it really depends. And then the next level of mental health services is inpatient. There's some others, but I'm not going to quite get into that because they are more specialty, meaning like, when I say inpatient rehab for crisis stabilization. I mean, it's not inpatient rehab, but inpatient for acute crisis stabilization. And most of the time, that is when someone is at risk of harming themselves or risk of harming others. Each state is different when it comes to substance use, but the person, in general, the person would need to, excuse me, in general, the person would need to have, not have, the main purpose is that they would need medical detox, meaning they need a medical team to make sure to pretty much monitor their withdrawal symptoms for substance. And so, in a nutshell, that is the basic services. There's so much more. And so, for a firm holistic network, part of our community, one of the things that we'll be doing, we'll have like group consultations when people have questions, specific questions that I can answer, even though it's in a group setting, but most of the time, most people have those questions. And then also, again, just different ways to alleviate stress, um, to alleviate stress, prevent, burnout, and resolve health-related concerns. And so, just by knowing how to access the mental health system, that really helps. Generally, when it comes to the therapy level, people can seek therapy for so many different reasons. At the intensive outpatient and partial hospitalization, those are, I guess you can say, when someone is overwhelmed. It's not a crisis, and sometimes it may be, and the person is not at risk of harming themselves or others, and they're not in need of a medical detox. And then when it comes to the acute hospitalization, meaning most of the time they're at your hospital, at your local hospitals that have psychiatric units, and then also it can be freestanding in hospitals. So just by knowing being an informed advocate and knowing the groundwork of how to access those things. And one thing when it comes to the inpatient hospitalization for mental health care, that process starts in the emergency room. A person would need to be evaluated at the local emergency room. And then in some states, not all, but some states have what they call mobile crisis team, and they may go by a couple of different names, or an evaluation by the mobile crisis team to determine if they need to go to the hospital for further evaluation. And one of the reasons I kind of want to talk about this is because sometimes people really do be struggling, and sometimes you don't know where to go. And again, when it comes to, crisis situations, these are the services that can be accessed. Now, when it comes to the therapy level, there's so many different options. You can say either in lieu of therapy or that can accompany therapy. Because again, for the parent company of a firm holistic network, it's about, really inviting you and letting you know of all the different possibilities of how to support someone and how to help someone, and basically really help yourself, because beyond, the traditional things that we see, because sometimes we may not be able to get access to some of these things by Googling, and sometimes we do, we just don't know what they are. So I wanted to kind of talk about these things in this particular episode, just so that you know that they exist. And once we do start the community consultation, the community group, then we can talk a little bit more in depth of, really how to access and all the details that can kind of go along. There are a lot of nuances that goes along, and it's a lot of frustration. This is part of why I created, why I started this business. because, just there's just not enough. There's just not enough. And everyone doesn't know everything that I do, but I want to share, with you with what I know. And so, thank you for joining me for this episode of Informed Advocate Podcast. And again, it's about, the self-care, about facilitating self-care, advocacy, and compassion among self-caregivers. And just by you being exposed to different information, this can help you while you're supporting others, and whether you're a personal self-caregiver or you're a professional self-caregiver, just by knowing some of the baseline of how to access mental health services, it can help you or it can help someone else. So thank you for listening